I'm Greg Feld, Director of Public Health for Sheffield. This is a COVID situation and epidemiology report from the 9th of February. So in short, not much change, certainly since last time I recorded a video. Case rates are flatlining somewhere about 1,000 per 100,000 a week, and we'll settle there. That's 1% of the population testing positive a week. Very, very difficult to interpret because the testing data, the number of people getting tested, is very odd at the moment. But the general consensus is it's about 1,000 per 100,000 a week. Rates in primary school look like they're going down. Primary school age look like they're going down. Ditto secondary school, but both remain at a really high level, and there's obviously capacity for further growth there. So we've got a cruising altitude. It's causing business continuity and some public health problems. That is as it is, but largely, as I've said before, better treatments, better vaccination, and the immunity that comes from vaccination has defanged the virus. So the level of harm that we're seeing is nowhere near as it was, and we all know where we're going nationally on this. But there's still lots around. Some people will be poorly, lots will be off work because they're poorly, off school because they're poorly, so it's still not gone away, but certainly a different picture epidemiologically than it has been. Hospitalisations still there, but drifting downwards, and they'll drift downwards for quite some time to come. That is a problem. That will limit the ability of the NHS and social care to kind of clear the backlog. There's a significant backlog of people waiting for operations, and a backlog in primary care, a backlog in social care. They're still busy with COVID, and so clearing that backlog is going to take some time. We've got to a space where we're sort of moving away from controlling the virus and breaking chains of transmission to learning to live with the virus, and learning to live with a virus that's, as I say, been largely defanged. It's not going to go away. It's going to be circulating around the world forever. And eventually it will become endemic. It's probably going to take a few years to become endemic, and the virus may evolve, so we need to be watchful for that. So then out into the medium term, we'll do some crystal ball gazing for the medium term. Waning of immunity is going to be a thing. We don't know how big a thing, but we're going to see it in those that were vaccinated and given boosters first, so the very old and NHS and social care staff. So we'll watch for very carefully infection rates in those that were vaccinated first, i.e. immunity will wane first, and importantly hospitalisation rates. So that will definitely be a thing out to the future. People are getting back to pre-pandemic behaviours with a bit of sophistication, so there's more accumulation of social contact, and that puts pressure upwards on transmission rates, but there's more immunity, so that puts pressure downwards. So broadly we're going to see flat for quite some time. The NHS and social care system will cope, but without much spare capacity. So as I say, clearing the backlog will be an issue. It's going to be around for quite high rates for quite some time to come yet, and I think we should be careful about use of the term endemic. Endemic implies stable but really quite low rates with very occasional flare-ups. We're nowhere near that yet, so we're kind of learning to live with a somewhat less dangerous virus. Long term, very, very uncertain. There may be new variants. I figure there will be. It's a matter of when, not if. We just don't know how that plays out. So whilst we are scaling back, I think we should be realistic that there may well be flare-ups, there may well be significant waves in the future, and how big a deal that is depends on the level of immunity, it depends on the severity of the variant as and when that emerges, it depends on whether or not the vaccine works against the variant, so some of that's highly, highly, highly uncertain. What we do know works is vaccines work and have a durable immune response. Physical distancing, masks and ventilation work, and we'll continue with some of that, and we'll look for a sort of a layered approach to keep us the harm from any and all future variants of the virus as low as possible, but reopen society, live with the virus safely because it's not going around anytime in the near future. So we get eventually, probably quite soon actually, I'm beginning to think about this quite seriously now, to recovery. We've just lived through the worst 2 years of our lives, I hope. I hope not to see another 2 years like it. And as I say, the virus is defanged but still there, and still not harm-free, but certainly much less harmful than it was. what does recovery, what does long-term living with safely look like? We kind of think through the fixing, repairing and recovering. The things that are worrying me a lot are mental health, particular issues around schools, kids and disruption of learning. That's going to have a long-term impact, and we need to be mindful of that and not pretend that's not a thing, because it is a thing. There's much greater public understanding of risk than there was, but admittedly some people are still really, really scared by the virus, and the thing is being fully vaccinated. As I say, it significantly reduces, but doesn't eliminate risk. Eventually, we'll move to this virus as just one of many respiratory viruses, probably a year or so away yet. So we keep on for now, fixing and repairing and recovering some of the stuff that did get broken in the fog of the last few years. And there are some specific things that we need to do, and also there's so many positives in terms of ways of working, the way in which we've all looked after each other in the last 2 years, which I think we'd be mindful to lock in for the future, because they've been very, very beneficial. So lastly, and very immediately, it's worth just making note of the Sheffield-wide Jab Cab scheme. The clue is in the title. A free taxi service for Sheffield residents to and or from COVID vaccination appointments is now available to the Sheffield Vaccination Centre. So call City Taxis on 0114 235 8997 and book with the code SCC Vaccine. Your trip there and back is going to be paid for by the council, and more information on the scheme is available at the end of the video. Lastly, the More Market vaccination clinic offers walk-in, no appointment needed, first, second and booster vaccinations without an appointment for anyone aged 12 or over. Clinics open 10 till 4 and we'll be open throughout February half term, so make sure that you and your family are fully protected if you haven't already done so. It's there and it's available. Please make use of it. Some countries require children aged 12 plus to be double vaccinated to enter the country, so if you're considering going abroad Easter and spring bank holiday, make sure your children are fully protected.